So welcome to our monthly DDSN provider meeting. We got lots of questions, which we really appreciate. So we've developed the agenda based on those questions. And we should be going through anything that we received. So with that said, I'm gonna hand it over to Margaret. She's first on the agenda.
Hi, good afternoon. Let me check my audio, make sure y'all.
I can hear you.
Okay, great, thank you. Just a few updates from DHHS. I did want to, we know we have questions that have come in regarding the 5% salary increase for state FTEs. We will apply the same method as we did last year for these increases. So there will be additional information coming out from the agency, but in short, we'll approach it the same way that we did for last year's increase. We'll need some of that same information that includes FTE surveys from you. We will also make sure employer insurance increases are included in the allocation. So again, more information to come from our finance team, but did want to let you follow a very similar process as we did last year. I know there are some questions also that have come in with regard to cost reports and the format for those. Again, more information to come on the template, but just by way of explanation and the reason that we still want to collect those for the most recent year is based on the rates that we have established. We did want to, for a period of time, essentially have something to compare against, just to ensure that we are in the right ballpark, we're moving in the right direction to support the provider network. So we don't anticipate requiring those on an ongoing basis, but at least for the first full year after transitioning to direct billing, we did want to have that information as another point of reference as we look at rates. So that is the reason. I see a question, or that's not a question, that's a statement, but in regards to the 1% employer rate increase as well. So that is noted. Also, updates, we did receive approval from Centers for Medicare and Medicaid Services. The HASKI waiver renewal has been approved. That should be posted on our website. If not already, should be in short order. We also gained approval from Centers for Medicare and Medicaid Services for multiple waiver amendments. These were to consolidate certain services. So we consolidated nursing services, which were previously split out into RN and LPN. We also consolidated personal care services, which were previously split out into a PC1 and a PC2 level. There is material that was issued by the Medicaid bulletin outlining this update, but intent was to help to streamline some of the administrative processes around service authorization, as well as coordinate our reimbursement around nursing and personal care services. Also, we continue to work on our project plan for transitioning community ICF to direct billing. We have initiated a formal project plan. We're taking into consideration that as we moved through our fee-for-service direct billing transition, that was approximately a 7 or 8 month effort with additional work on the front end of that. We are taking into consideration with regard to the ICF direct billing transition that there will be time needed to move through licensure updates with DHEC. So we are accounting for that in the project plan, but we continue to move forward with outlining the timeline and what we would expect with that transition project. As we have a better feel for timing. And I thank those of you who have already volunteered to help us out in piloting some of those efforts. We will be reaching out to you, but we are continuing to get our project plan outlined and the timeline that we feel is going to be achievable outlined for all of you so that you can plan accordingly as well. So for the one question before I turn it back over to DDSN, this is what I first referenced was the 5% salary increase for state FTEs that will follow the process that we followed last year, and additional information will be coming out from our department as to any reporting in terms of FTE surveys that will be required.
I am also going to put a link into the chat or to the questions so that you have a link to where the provider rates are located.
Great, thank you, Lori.
All right, my turn.
Yes, I'll turn it back over to you.
Awesome. So I wanted to just give a couple of updates around case management. First off, we're continuing to move down the road related to conflict-free case management. As a reminder, our target date for that is the end of December. So we're just several months away. We, if you are one of those agencies who still has a good number of conflict-free cases, we will be reaching out. We're going to try to push you along a little bit because we're getting closer to the deadline. The other thing is we are working on the unraveling of the Appendix K, as well as some of the other flexibilities related to the public health emergency ending in May. So I say that to you to just have you remind the case managers at your agency, if somebody reaches out, we really need to take action on those things. Everything is time limited. We want to make sure families know well ahead of time services that will no longer be available to them. The biggest one being parents of minor children being paid to do care. So we don't anticipate stopping that flexibility until the very end, which is November. But we want people to know ahead of time so that they have plenty of time to try to arrange that care otherwise. The last thing that I wanted to tell you about is solicitation that will be going out in the very near future for intensive care coordination. We have a number of cases that are in very critical circumstances. They have involvement with justice systems. They need interventions from multiple state agencies. We're looking for providers to submit proposals to have a caseload of no more than 15 in order to address these cases. So be on the lookout for that. It's going to be pretty time limited. Like we want to get those proposals in and then get some training that we've developed on up and going so that we can get those started. All right, that's it for me.
I think I'm next on the list. Hey, everybody, it's Quincy. We got a few questions, some of them similar to ones that Margaret has already kind of addressed. I'll just start with the first one. There was a question about the audit directive not being out yet. I just wanted to remind everyone that there is an audit directive that's currently in place. It hasn't been updated this fiscal year. I don't anticipate any of the changes being updated until DHHS releases guidance and in their timeline. Also, there was a question about the Medicaid cost report format for fiscal year 23. DHHS is also going to give you that guidance and that cost report manual. And DDSN will not be issuing what that format should be. There was also a question about cost allocation plans. DDSN Administrative Standard number 608 states that the boards shall submit an annual cost allocation plan that's prepared in accordance with Medicaid cost principles and also in accordance with DDSN Directive 250-05-DD. So this is the current policy that's in place today. I do anticipate there's going to be changes to that policy once Medicaid or DHHS releases their guidance. Section 4, subsection C, number 2 is titled Step Down Allocation Method. That's based on guidance. That's going to be based on guidance that's issued by DHHS. So I can't speak into detail what intermediate cost centers DHHS is going to require the boards to use for their Medicaid cost report, as well as the step down order they're going to require you to allocate your expenditures. So DDSN's current policy gives more flexibility than what I've seen in other Medicaid cost reports. So anticipate there will be changes to that section once HHS releases their guidance. We also received a question about stored value cards. We reached out to a couple of providers for input and found that providers are using these stored value cards differently in some cases, as some are being used as cash on hand. So that being said, we're still having internal discussions about updates to policy 200-12-DD. But we do want to be thoughtful about this, considering stored value cards, they have a very good value and there's a built-in audit trail. However, there are other things that we have to consider, such as monthly fees and who's going to pay those fees. So once we finish those internal discussions, I'm sure we're going to be discussing this in either a monthly forum or, or work group of some capacity. And then, of course, it's got to go through the policy approval process. There was also a question about GASB 96 and if it should be reported in the fiscal year 23 audit. And to answer that question, maybe. If you're a provider who produces GASB financial statements and has any subscription-based information technology arrangements, then you should speak to your contracted CPA about implementing GASB 96 into your financials, as that effective date applies to any reporting period that is after June 15th, 2022. So your 23 financials should include GASB 96 updates. And that's all I have for the questions that were submitted. Is there anything else in the chat or Q&A?
I don't have anything, Quincy.
All right, next on the list is Janet.
Okay, I think that's me. So we got a few questions that we kind of grouped into legislative updates. So there was a question about the Bill S602. As you all know, it's a 2-year legislative cycle. Last legislative session, that bill passed from the Senate to the House and into subcommittee. There's been no additional activity and we've not heard anything else about it. So I guess we'll have to wait till January. There were some questions about sub-minimum wage, specifically the task force. So just a few things that are in the sub-minimum wage act. It talks about DDSN submitting a report in January that includes the providers with 14C certificates, those who are paying sub-minimum wage, providers who did pay sub-minimum wage but stopped, providers who are now paying minimum wage that used to pay sub-minimum wage, and then the success of obtaining minimum wage for people with severe versus mild or moderate disability. We did provide a report in January based on information that we had collected. So we did that. The other thing that's in the bill is about the South Carolina Task Force on eliminating sub-minimum wage. That included that DDSN was to appoint two providers to the task force, and those providers had to be providers who were authorized to pay sub-minimum wage. We did that. Those representatives are Tyler Rex and Thoy Warren. The other thing is that we were to appoint 2 people who are or were paid sub-minimum wage. 2 people were identified. One was previously or currently supported by Burton Center, and the other one previously and or currently supported by Community Options. I don't know the specifics of that. The responsibility for convening and directing the task force rests with legislative staff. Our understanding is that it's probably going to be Mason Thomas with Senator Katrina Shealy's office who will be leading and directing it. DDSN is not the entity tasked with leading and directing that task force. So we are submitting information in accordance with the law, but DDSN will not be convening a meeting, and we are waiting on direction for when it will be, when any meeting will be convened. I know there is a report that's supposed to be due in August, or before August of 24. I'm not sure, but anyway, whatever that report is, it's not DDSN's responsibility to convene the work group or produce that report. There was also kind of, as part of that legislation, a commission that was to be established called the South Carolina Employment First Oversight Commission. It was to have 9 members appointed by the governor, and the governor was to appoint 1 member to convene and organize the first meeting of that commission. We did check with the governor's office this morning, and they have not appointed the 9 members, so nothing has been done with that. Lastly, in the whole realm of legislative updates is we were asked about the current status of part 2 of the Legislative Audit Council review of DDSN, and nothing has been shared with DDSN, nothing has been released. As early as last month, we were still getting requests for information and questions from the Legislative Audit Council, and we have no idea when the report will be produced at all. So that's all I had for legislative updates. Is there anything in the chat, Lori?
No, I don't have anything.
Ann, I think you're next.
All right, so I wanted to make sure that everyone was aware, the fiscal year 24 administrative compliance and individual service reviews, licensing review, and day and residential observation participant experience surveys are well underway. The key indicators for each of these different review processes have been posted on the DDSN website under the quality management section. In addition, we have recently posted information about the post-payment claims review process. This is in a separate section under quality management on the DDSN website. This is something that we have been talking about for several months, and post-payment claims review is a requirement within our waiver operations. We are currently in the process of hiring staff and expect to begin this process in the second quarter of fiscal year 24. So again, this will be DDSN or state employees that will be carrying out the post-payment claims review process and not the quality improvement organization. There was a question submitted to the provider forum about whether the invoices for state fire marshal inspections could be sent directly to the provider agencies rather than having the invoices flow through DDSN. And the short answer to that question is no. But to provide more of an explanation, DDSN is modeling its invoicing similar to how the Department of Social Services invoices its provider agencies or its contracted providers for their state fire marshal inspections. So it's going to be essentially the same process. The state fire marshal's office will invoice the respective state agency, and then we will in turn send the invoice to the provider agency. There will be separate invoicing for annual inspections versus the follow-up inspections. And of course, costs to providers can be reduced as your compliance through the annual inspection process increases. I do want to remind providers that there will be cost incurred for no-shows or missed appointments. So if the fire marshal goes out to complete an inspection, please make sure that you have staff there at the time that was previously scheduled. There was also a question about the current status of the proposed incident management directive. DDSN and DHHS staff met as recently as this past Friday to discuss the directive and its individual components. The two agencies will continue to work together and will include providers in a small group discussion at a later date. So that will be announced later on. And as another question that was submitted to the provider forum, does DDSN have sample quality management plans that can be shared among providers? We do not have a specific template for the quality management plans, just as there is no one-size-fits-all plan among providers. Different providers serve different populations. They have a different way of conducting their business. So we are not mandating a particular template. We have included a reference in the July 2023 Quality Management Bulletin, which includes several questions that providers will want to make sure they're answering as they develop their quality management plans. And that information can be reviewed on page 2 of the Quality Management Bulletin, which again has been posted to the DDSN website under Quality Management, and it will be sent out to all of our providers using the distribution list later today. Also, as general reminders, several notices have gone out to providers for addenda that are needed for abuse, neglect, and exploitation reports, critical incidents, or death reports. Please be sure to submit an addendum for any changes in the disposition status or when there is new information available to update a report. This may include evidence of any remediation planned in the prior reporting documents. If your agency has not completed the National Core Indicators State of the Workforce Survey, please do so this week. NCI extended the deadline from June 30th to July 31st, but the deadline will not be extended beyond that. Right now, we have about a 73% response rate, with 45 of our 62 agencies qualified for the survey that have participated. And that's all I have at this time.
Any questions, Lori?
I don't have any questions.
Okay. So that's back to me, policy updates. So a couple of things that there were a few questions around provider qualifications, etc. So on Thursday at the commission meeting, there was a new directive that was called Provider Qualifications and Contracting that was approved. So just to kind of explain where DDSN is and why that directive was necessary. So historically, as many of you know, DDSN has followed state procurement in order to contract with providers to deliver services. First, 20 years ago or more now, we did an RFP. So request for proposals for new providers, and went through that process. It switched to a fixed price bid, but what we were doing was we were creating either a solicitation for an RFP or a fixed price bid and working through the state's material management office to get those proposals, to review them and give them back. What we did this year is DDSN, along with other state agencies, not just DDSN, there were several state agencies that approached the State Fiscal Accountability Authority, that is often referred to as SFAA, SFAA, and we asked for approval for a process that would allow us not to have to go through the materials management office and do a fixed price bid or a request for proposal. They approved for DDSN to be able to do that, with the caveat that any agency approved would have to have a policy that explained what we were doing as far as contracting with providers for needed services, That policy had to be approved, and that policy had to be presented to the State Fiscal Accountability Authority. So what that means is that we can have a much less laborious process to approve a provider and enter into a contractual relationship with them. There won't be pages and pages and pages and pages and pages of information from the state. Instead, it will be a provider qualifications process. That policy was the first step. When we get that policy to the State Fiscal Accountability Authority, when we get it to SPA, then we will be able to introduce qualifications for providers. The other thing that's different, if you are currently a provider, you do not need to respond. Okay, so this provider qualifications document that we will be standing up is for new providers. It is not for existing providers. So there will be no need, like we've had in the past, we've had providers that have had to come through, unless you were Disabilities and Special Needs Board, only doing business within your catchment area, your county or counties. If that's all you were doing, you didn't have to go through the RFP or the fixed price bid. But if you were going to operate outside, you had to come through that process. Now you do not have to come through that process. We have a different process that will be for new providers only. So we're not using this as a requalification process. It is only for new providers. However, there needs to be a requalification process for all providers. So by the 4th year of a 5-year contract, we will requalify providers. We will ask for each provider to submit information for requalification or have some sort of requalification process. Since that first requalification process won't be until 2026 or 2027, we don't have it figured out yet. We know that it'll be something relatively abbreviated, probably attestations or a couple of submissions. We will certainly use any quality management data that we have collected in the process. But what exactly that requalification process will be, we have not figured that out yet. And we got 4.5 years, so we will figure it out, and we will have it out by probably the beginning of the last year of the contract. So the other policy-related update is around the background checks document that was discussed in the policy committee last week. We've gotten a lot of comments about it, and it is one of those things where DDSN does need to meet internally to discuss it. When we meet, we're going to follow the law, the South Carolina Code of Laws, which is at 44/7/2019. That'll be our guide. We had a specific question about whether or not a provider other than Identigo could be used to do fingerprinting for agencies. I don't know the specific answer to that other than the answer is no. What we believe is that the state did an RFP and Identigo was awarded the state contract. So Identigo is what every state agency is required to use. So changing that or having different agencies is not something that we see as being something we can change. Another question was about the fact that everything gets channeled through DHEC. So if you go to Identigo, you get fingerprint checks, it goes to the FBI. Those results come back to DHEC, and then they come back to DDSN, and then we get to tell you. Kind of a long process, I get it. But the fact that DHEC is the, quote, channeling agency is in the state code of laws. So again, I get it, but it's not really something that DDSN has the ability to change. It specifically says that DHEC is the channeling agency for those checks. So again, we're going to be taking a look at background checks as they relate to the directive and have some internal discussion. We hear what you're saying, and we will certainly take that into consideration. And with that, I'm going to pass it to Carolyn Benson.
Hi, guys. Good afternoon. My name is Carolyn Benson. I am.
Hey, hold on 1 second, Carolyn. I do have a few questions, right? So let's let Janet address these, and then we can, go from there. So one question that was asked and answered was around where to send FTE reports. And the answer to that is that the HHS is going to provide instructions on submission of the FTE report. So at this point, just hold on to them. There's a question that says, if a provider is qualified for individual employment only, where do they apply to become a residential provider?
They'll come through this process when it
correct.
stands up.
There's a question that says, are private providers mandated to use the company that the state agencies use for fingerprints? And I think because it's a contracted service, it falls under what you just explained. Is that correct, Janet? Or are private providers able to use whoever they want?
I think it falls under that process. I also don't think that the FBI just gives background checks to people or companies, but I don't know. From our understanding from the beginning, there's one channeling agency for the other state agencies, and if you're contracted, if you're doing it because DDSN is requiring you to do it, that's where they go.
And then there's just kind of a request for DDSN to advocate for there to be more than one provider to do the background checks when the state contract is ended, just because of the time constraints, I'm assuming.
We understand. And apparently that has been good for their business, because I'm reading that they make appointments and are no-show.
Right.
But the company's not open when you get there, so that's a problem.
I think the point in all of that is we hear you, we understand you, we've kind of gone down this road a couple of times, and it's just not possible. All right, Carolyn, sorry about that.
That's okay. So I have updates regarding contracts. As you are all aware, we have been working on the contract with all of you. Previously, you had sent questions and comments, and we addressed those prior to us even starting making any changes. We understand that you have additional questions now. Some are very specific, some are just generally related to appeal rights. Based on the questions and comments that we received, we reached out to the legal department at HHS, and we're hoping to get some clarification and work with them to follow up with you. So if you have other questions, we're asking that you send them all to us by close of business this Friday, July 28th. And you should send them to the forum agenda email address, the same one that you used for today's meeting. Our plan will be to get all of those on Friday, take a look at those early next week, and then by the early August, we hope to send the final contracts out for signature. We understand that some of the contracts have recently went out, I think last week. Please disregard those. You should not be docu-signing any of those. Again, early August is when we'll send you the final version. We do want to note that while we will answer questions and try to provide clarification, we don't think we will be making any substantial changes to the contract. So they are pretty much, what you see now is pretty much what you will get. After you hear back from us and get that clarification, if you are still confused, we recommend that you would seek outside counsel, as we're not providing legal advice to you, we're just providing clarification. If there aren't any other questions, I'm going to pass it to Harley.
You go, Harley.
I got it. Okay, I just had a few updates, communications wise and about the EHR, our electronic health record. So first I want to mention the provider focus group. So we'll be convening another meeting with a group of providers that have been, whose names have been provided to us through the provider organizations. That next meeting will be on August 1st. So Tuesday of next week. And then we will be talking about residential needs. And there was a question around emissions transfer discharges, that process. And so we'll of course include that question as part of the discussion to provide further updates to the provider network as a whole. In addition, the next monthly provider meeting, so scheduled for August 21st, that will be the in-person meeting. We appreciate providers working with us this summer to delay that in-person meeting till the end of the summer, so in August, when school starts back and the summer unofficially ends. But that sign up process will mirror the March provider meeting that was in person. And so communication on that will be coming out this week for how providers can sign up to attend in person. And then the final thing I wanted to provide an update on is the EHR, so electronic health record, request for proposals was solicited through state MMO, so state procurement. And so we're in that process now of dealing with that solicitation. However, I do want to note that we would like to include providers as part of the subject matter experts group. And so as part of that, you would be provided access to the proposals, you would have the opportunity to review them and be pulled into meetings with the panel who will be evaluating those proposals for subject matter expertise. That a formal request will come to the provider organizations. And so we'll ask each provider organization to nominate one individual to act as a subject matter expert. And so information on that will be forthcoming after the selection process has happened and we have the individuals that we can then pass on to state procurement for receiving the forms, et cetera, and access. So again, we appreciate y'all's input and want to have it as we review and assess the different EHR proposals that we will be, one of which we will be implementing, in the near future. So those are my updates, unless y'all have questions for me.
There's a question about the number of organizations that have responded to the RFP. I'm not sure we know that.
Yeah,
yet,
I can't
but-
speak to any of that. There's no details that I can provide. It's those that are submitted by the provider organizations and then have access to that. You have to sign non-disclosure agreements and all that good stuff. So yeah, it's not something we can talk about publicly.
Yeah, the SMEs that are chosen will have to do the same.
Exactly.
Okay, were there any additional questions?
Do not see any.
All right. So our next meeting is August and it is in person as an option.
As an option, there will be a virtual option as well.
And I think that's all we have on our agenda.
All right, thanks, everyone. So we did get a question kind of at the last minute. And I think it's about the solicitation for this complex care coordination and whether or not there will be training that would go to everybody. No, the training will be specific to these positions that we're trying to stand up.
How is
There's
it that we're well behaved? It's because they're muted.